I'd like to thank you for watching this video and showing interest in our fellowship training program. As you all know, because of the ongoing pandemic and COVID-19, we'll be performing most of our interviews or all in a virtual fashion. And we wanted to give you a little information ahead of time to help you select where you interview and give you some information about our program. I'd like to talk a little bit first about the history of our program. We're a colorectal fellowship that's been here for a long time. Our first fellow finished in 1977. So it's been over 40 years that we've been training residents in colon and rectal surgery. We're proud of that long history, and for most of that time we've been training one to two fellows per year.
I think we have an excellent program that teaches the breadth of the specialty, and this is a wall of all the photos of all the graduates of our program who are in practice from anywhere from Alaska to New York State to Puerto Rico.
I did my general surgery training in Connecticut at the University of Connecticut, and I had a really good time there. And I went through the whole interview process just like you guys are all doing right now, and interviewed down here, really liked it, and I ended up down here. You know, coming to the South as basically a lifetime Northerner, I didn't totally know what to expect. I've visited before, but I'm certainly not a Southerner, so didn't know how it was going to go, and you know, it turned out to be really good. Everyone here is really nice, welcoming. Everyone's super friendly, friendlier than they are in the North. But overall, it was a good experience.
This year we will be interviewing for one fellowship position, and we currently have 3 core faculty members, so it's a 3-to-1 faculty to resident ratio. We also have one affiliated university-based colorectal surgeon who's a case log faculty. A little bit about our program. One of the things that differentiates us from some other colorectal programs is that we are a private practice-based training program. Although we're affiliated with the university here, including the medical school and the general surgery residency program, our fellows train primarily in our private practice setting. We practice at 2 different hospitals here in Shreveport, 2 different healthcare systems, but both the hospitals and our office are within 1 mile of each other, so there's very little travel time. We divide our rotations for the residents based on those hospitals, so you spend 6 months at each hospital, and the other hospital during that time is covered by a mid-level general surgery resident, usually a second-year resident. And although you have a general surgery resident working with you, there's no competition for cases because the fellow always gets first choice for any surgical cases.
Coming to the end of my training here, I feel like I've learned everything I need to know to become a well-rounded colorectal surgeon. I've had really good exposure to endoscopy. I've done about 300 colonoscopies this year, and also open and laparoscopic surgery for both benign and malignant disease. The other really good thing about this program is you get a lot of exposure to anal rectal disease. So I've had a lot of exposure to complex fistulas, perineal prolapse repairs, as well as sphincteroplasties. And you also get a good exposure to pelvic floor disorders when you go with Dr. Grimes and work with him doing anal rectal physiology. So I've had a decent exposure to anal rectal manometry as well as endorectal ultrasound.
Because we're a community-based private practice setting, we see a wide variety of colorectal issues and problems and treat the full breadth of what a colorectal surgeon can treat. Our practice is not specialized in any particular areas like cancer or inflammatory bowel disease, but rather we see everything from fairly routine benign anorectal surgery up to pelvic recurrent cancers and advanced inflammatory bowel disease. We do a lot of endoscopy in our practice as well, so the residents get excellent experience with that also. Our program is structured so the fellows have 2 full operating room days a week and then spend at least 2 mornings a week doing endoscopy and 2 afternoons a week in our private office here seeing patients with us in the clinic setting. We have a university-based clinic 1 half-day a week as well. It's staffed by one of my partners, Dr. Grimes, and that's the only interaction that the fellows will have with medical students during their year here. We think that provides excellent training for the residents, especially those who are anticipating going into a private practice community-based setting much like ours, because you get exposure to all parts of colorectal surgery, including the office-based practice.
Some of the things I like about being a fellow down here are you get a really good taste of private practice colorectal surgery. You rotate at 2 great private hospitals, and you also work in the clinic at LSU Health Shreveport.
Hopefully, it'll give you a little bit of information about what we are, who we are, and what we do here. And we will be accepting applications through the ARIS system and extending interview invitations. So please make sure everything is in place in time before the August opening date of the application system. Again, thank you for your interest, and I wish everybody good luck in the application and interview process.